Gait patterns are great as part of a balanced program, and it's a nice way to increase the heart rate just a little bit towards the end of the workout, or even as part of the warm-up you can put them. Now, we talked about the more advanced ones such as lunge walks. Again, for prenatal stages, it would depend a lot on the previous fitness level of the woman, as well as whether she's got any sensitivities in the pelvis. So that is one example of, say, an advanced gait pattern. Another one would be sled pushes if they're very strong and they're not allowing things to hang and cone. They would be able to do sled pushes at a slightly upward angle. That will of course work their legs and help strengthen the muscles of their knees and their knee stabilizers, which is going to be important as their connective tissue gets more loose and they lose a bit of stability and balance. In terms of the standard ones that are always done for both pre and postnatal is the farmer walks. So I'm just going to grab these dumbbells and you pretty much just walk a nice upright posture, shoulders down. You'd walk, of course, in a longer distance. I'm just doing a short one so that you get the idea, and I stay within the camera frame. And the suitcase carries are the same, but the arms come out a little bit wider to work the shoulders more and the delts. And now I need lighter weights. These are a little bit too heavy to go for long, but it feels good. And they're certainly great for improving posture and just getting things a little bit more dynamic. Remember, we talked about that pregnant women don't like to stay static for too long. They need movement in order to get blood and lymph flowing, and they feel nice after the session rather than drained. Pushing exercises are also very important because they're going to work your pec, your chest muscles, and your triceps. Now, of course, in the postnatal stages, things start to change, and it's a goal of a lot of women in the postnatal stages to work on their pectoral muscles. So bench press in general, if we're going to think of someone pregnant doing a bench press, you've got to remember that you've got to incline the bench so she's not lying flat on her back in the second and third trimesters. So on an incline bench, we would sit down, and obviously in the postnatal stages, you can do this on a flat bench, no problem. And then you would do all your usual bench press exercises with the same technique that you've been coaching them already. So your standard chest press, you could do your pec flies to really get the fibers of the pec working, obviously with slightly lighter weight compared to your chest press. You can do the chest press with the hands stuck with the dumbbells stuck together to target more triceps. And you can even do your skull crushers with slightly lighter weights, where you're focusing more on the triceps themselves. These are a little bit heavy for me for skull crushers, but you get the idea. Then, of course, you can do, let me put these weights away. You can do, of course, your push-ups. Now, if someone's got, if they're pretty weak in their upper body, especially in the postnatal stages, go back to taking them push-ups against the wall. If they're a little bit stronger, you can get them on a box like this doing push-ups. Now, for a lot of women here, that you will tend to see coning. So it's not to say don't do them, because it actually could turn into a very good core exercise, but keep your eye on what's going on here so that they're not letting everything hang with gravity. They're lifting, they're drawing in, and the whole time they're keeping everything very connected, including a little bit of squeeze of the glutes can help feel very connected and safe. Of course, if they are too weak for this, you could lift their bottom a little bit, and then it becomes a little bit more emphasis on the shoulders, so it's more of a pyramid pike push-up. So push-ups in all their variations, obviously the capital A one, the more tricep one, all of this is going to be very useful. On the cables, you can do your tricep extensions, leaning forward a little bit to allow for space for the bump, and then pulling the arms apart and stretching them down, holding for a second, and then releasing, remembering to do your connection breath as you're pressing the arms down. So now we get to the exercise library in a gym setting, and this is for those of you who are trainers who want to know how to apply some of the principles and concepts we've been talking about to the gym environment. Now, although already you can continue pretty much doing the routines and workouts that you've already been doing, just applying the rules and regulations that you've learned in this course to the person in front of you. But here are just going to be some ideas of adaptations that you may not have thought about to some of the classic exercises. Before we get into the exercises though, I just want to remind you of how to breathe when you're lifting weights in order to reduce intra-abdominal pressure. So this is specifically for both pre and postnatal. I know some of you may be powerlifters and you breathe in an entirely different way when you're lifting weights, but for pre and postnatal, the goal is to reduce intra-abdominal pressure. So you're always going to lift on the exhalation. That should be your primary focus, is the exhalation initiates the lift. Say we're coming down in a squat on the inhale, and then we start to exhale, and then we rise up. This will reduce intra-abdominal pressure, and as you're coming up, you want to think of drawing in and up the abdominals from the front. Remember the zipper going from the front, the zipper going from the back. You want to feel like everything's going towards that magnet in the center of your rib cage, which you can actually pretend is your diaphragm. Your diaphragm is sucking everything up and in with it on that exhalation, and that will reduce the intra-abdominal pressure to prevent things like hemorrhoids, prolapse, keeping the diastasis recti for a long time after. All of this this type of breathing should help as you're doing the lifts. So let's go ahead and just practice that one more time. So inhale to prepare. Exhale, think of drawing in and up from the front and from the back. Bring it all up towards that magnet in the center of the rib cage. And now let's do it with body weight squats. We're going to inhale to bend, and then exhale, draw your sit bones together and bring everything up towards the center of the rib cage. So feel like the exhale initiates that lift, and apply that to all the exercises. So now we get to the gym core exercises. I already showed you some on the mat, but in the gym, pretty much everything is working your core, especially when you're doing weighted stuff. Remember that your core muscles are force transfer muscles from the lower body to the upper body and from the upper body to the lower body. So they're working all the time. But if you wanted them to work more specifically on their core, the pal-off press for prenatal, both pre and post actually, can be very beneficial. So you put the weight on the cables, something comfortable to start with, and then you're working your core isometrically as an anti-rotation exercise. The cable is trying to turn you, the cable is trying to twist me this way, and I'm trying to stabilize against the core, against the cable. I just stretch out and I come back in, I stretch out and I come back in, and I could feel everything working. And then of course I would do it the same on the other side. So that's a great one, very popular one to do for both pre and post stages. You can then lift this up higher, and you can do wood chops. When you do wood chops, they're great for your obliques, but it's important that you don't get the twist happening as your feet are grounded, because that might create too much torque in the bump itself. So as you twist, make sure you pivot with your back foot. You pivot so that everything's turning together, or you do a squat and you reduce the amount of twist. And you can of course do that with a medicine ball or a dumbbell. And of course both of these exercises can also be done with a band. If you're doing home visit sessions, you can do your pal-off press here, you can do your wood chops, just lift the band a little bit higher, and you do your wood chops a little bit from the upper corner down. And even just horizontally, turning like this, pivoting my back foot, turning my back leg, will work the obliques in a way that isn't adding too much torque at the bump itself. In terms of your stabilizing typical plank exercises, typically for most people, you'd need to have an elevation. Some might not even be able to do this without coning. So if they are coning, just lift their bottom a little bit and get them to really consciously engage. Make sure you can actually see their abs. If they're wearing something loose, just get them to tuck in so that you can see what is actually going on here, and you're monitoring that closely. And make sure with all isometrics, as we said before, that you're breathing continuously so we don't get spikes up in blood pressure. In terms of the side plank, you could do it on the elbow or the hand, whichever they prefer. And the bump, as it grows, starts to twist and hang down a little bit, creating too much torque for a lot of women. So you can get them to hold their bump up this way and continuously breathe. And then if in the postnatal stages in particular, they're feeling up for it, to increasing the intensity, you can do mountain climbers on an incline as well, like this. And some women, you know, they're fine to do that on the floor, even in the postnatal stages. But again, it really depends whether the gap is closed, how quickly it has, whether they've got any hernias, things like that. All the stuff that we've already talked about, you've got to play it by ear. So there's no hard set rules. Everything differs depending on the individual, and you've got to communicate and observe your client to make those decisions. Next, we get to lunges, and lunges are not so comfortable for everyone as their bump grows. As the bump grows, typically women prefer more static split squat type activity rather than lunges, which tend to get your heart rate up quite a bit. And remember, the center of gravity is shifted forward, so their whole balance feels a bit off. Their balance feels off. Their ligaments are more lax because of the hormone relaxin. So yeah, I mean, I would still put lunges in depending on the person in front of me. I could get them holding on to a bar. And if I was to pick front, side, or back, usually reverse lunges most people feel safer in, especially if they have knee trouble, but also they feel more balanced, more controlled in the reverse lunge compared to in a forward lunge. Of course, they can do forward lunges, and if they've got SPD, I would avoid them altogether or do a very narrow stance. But even then, I would probably do split squats, just going down and up rather than an actual step and then coming back in. If they're doing side lunges as well, depending on the pelvic situation, the SPD is how wide or how deep they'll actually be going. And everything comes back to what are they used to before? What have they been training at before? What has their body adapted to already? You could then, of course, if their balance feels okay and they want to actually work on their balance because they feel that it's going a little bit off, they can do front, and then they could do 45 degrees. So these are compass lunges to the side, then the 45-degree back, then reverse back, then curtsy, and then we do the same with the other leg. So we go forward, we go 45-degree, we go directly to the side, we go 45-degree back, we go directly back, and then they do all the different directions, including, actually, you could even add 45-degree forward like that. So these are all the different lunges. If you do walking lunges, again, keep the stance quite narrow. That will increase the heart rate up for most people. But again, if she's super fit, she might be perfectly fine with walking lunges. So now we get to the pulling exercises, which is really important because it's going to strengthen your back and your biceps. It's our back and our biceps that are involved in pulling exercises. Of course, in the postnatal stage, that's going to be very important to have a strong back to counter the effects of breastfeeding and carrying. Pulling exercises as well is going to help us feel strong so that we carry better. And in the prenatal stages, it's important because we often tend to see women go into a little bit of kyphosis in the prenatal stage to counter the lordosis that's happening lower down. So by strengthening the back muscles, it'll help keep her posture open. So face pulls are one of everyone's favorite pulling exercises. You can do them on the cable, or I'll show you how to do them with the band as well. But you just take a split stance and you pull the center of the rope towards your face and then back again. This will work your rhomboids, your lower trapezius and your middle trapezius and your posterior deltoids as well. A lot of people like to hold in this stance with the hands. Feels more comfortable for some. Just do what feels comfortable. And then, of course, you can do it with a band if you've already if you're doing home visit sessions and type, you can do the exact same thing and angle the band according to which muscles you want to work. Bicep curls, of course, with the dumbbell are pulling exercises that are super, super useful. People sometimes say that bicep exercises aren't functional. This is one of the most functional exercises you can do. We're constantly using our biceps for everything that we do in front of our body, and it makes the, to keep things varied. Don't forget your bicep curl variations. You've got your hammer curls, you've got your Zottman curls, because it's going to be so important that she has strong, not just biceps, but strong forearms as well. Again, you can do all this stuff with the band. You can put the band underneath your feet and do bicep curls this way, or you can keep the band attached horizontally and you do bicep curls this way. All of the variations that you do with the dumbbells, you can do with the band as well. Then, of course, we get to the shoulders. The shoulders are also very important. You've got your front delts, your middle delts, and your rear delts. For the postnatal stages, we want to prepare them from when they're pregnant as well. They're going to be carrying a lot. They're going to need strong shoulders. So front raises, usual standard position, maybe keeping the knees soft, really making sure they're not swaying, really making sure they are connecting and doing their connection breath. And lateral raises, of course, is fine as well. Their stance may need to be a little bit wider than it normally is. And you can get them doing all that sitting down as well, so that they can do it seated if it's more comfortable for them. For the rear delt flies, because when you do it like this, there tends to be coning, it's better to have the bottom resting against the wall. It's not just about the coning, but it's about taking pressure off the lower back. Some people cannot stand being here for too long, and for pre- and postnatal stages, this area is already sensitive, it's already tense. We may not want to add more pressure to it. So just having the bottom against the wall and doing this, and at the same time hugging the baby nice and close towards us so we're not coning, would be good. Most women prefer to hold the plates instead of the dumbbells. So you would just get them holding the plates like this, and then they would do it this way. And that's for wrist comfort. So most women like to hold the plates because it's more comfortable for the wrists as opposed to the dumbbells. But again, just play it by ear, and remember that these are small muscles. They need smaller weights than what they're used to. Just wanted to do a short clip about machine weights, cardio machines, as well as resistance machines. They're very comfortable for pregnant women. Also postnatal women too. I mean, they're comfortable because they work more in isolation, so you're feeling everything nice and simply. You're feeling all the muscles. They're very effective. They're very comfortable. You're sitting down for a lot of them, and with all those sleepless nights, it can feel very comfortable to go do a gym workout session on machines. And also for the pregnant women, especially as the bump gets heavier, they tend to, at least I noticed with all of my clients, they used to like machine weights actually more than free weights, because they used to feel very out of breath towards the end of the pregnancy and just too much changes in dynamic position. Sometimes they just wanted to sit down more while working out and feeling the effective workout still. In terms of cardio machines, the ski erg is a really good one for cardio, because it's teaching them the hip hinge that we talked about already, but at the same time, you're getting your heart rate up, you're getting your full body working. And remember, the RPE here again shouldn't really go above a 6 or a 7, because it should feel like you're still able to keep up a conversation during the cardio. With the rowing machine, you just want to be careful, of course, about the size of the bump. As you're pulling in, it may start to feel more uncomfortable, and the knees may start to widen a little bit on the rower machine as the bump grows. So the rower is a bit more suitable for early stages. Of course, your treadmill is fine. Your bike and stair climb and elliptical and all that stuff, it all depends on whether they've got SPD or not, or discomfort in the pubic area. If they're okay with it, then you can keep going. Lower back pain as well and sacroiliac joint strain, as we were talking about, sometimes can bring on discomfort when we split the legs repetitively also, so just be mindful of that. In terms of the weights, the machine weights, for resistance training, the leg press machine, you just may have to take a slightly more wider stance as you push, so you don't feel blocked as the bump grows. All the other machines are pretty much fine. I think I mentioned, as I was telling you about intra-abdominal pressure, that the lat pull-down machine for me, I felt too much intra-abdominal pressure here. You've got to, it's very random and different for each person. You've just got to communicate with your client and ask them, where are you feeling this exercise? And if they tell you their abs when it's supposed to be a back exercise, and it's subtle, ask them if it feels subtle, or does it feel like the abs are shouting rather than whispering. Go through all that conversation with them so that they can communicate with you what they're feeling, and you can make judgments accordingly. But all the machines are pretty much fine. The adductor and the abductor machine, again, if they've got SPD, they may not find that comfortable, but most pregnant women find it comfortable because they get to choose the range at which they open and close the legs. And in terms of the obvious things is you wouldn't pick a prone exercise like a hamstring curl, you'd pick a standing hamstring curl exercise instead. So in general, I would recommend using the machines a lot, especially for your clients that are not so experienced in the gym, but in general, as they get to third trimester, they would probably be very appreciative of doing more machine weights. The next pattern as part of a typical program is hip hinging exercises such as deadlifts, etc. These are really important to strengthen our posterior chain muscles. Obviously, during the pregnancy, we talked about the pelvis going into an anterior pelvic tilt, which typically lengthens the glutes and hamstrings, making them weaker. So we need to keep those strong. And also after the babies come, we need to re-strengthen them again, all the posterior chain muscles, including the mid-back, because of all the carrying and breastfeeding that's going to help to counter all that. So hip hinging, if people aren't used to hip hinging and they're coming to you and they haven't learned how to hip hinge before, it's a good idea to get their bottom against the wall and their knees a little bit bent, slightly forward, and just learning how to hip hinge, maybe with the bar here on the back, the stick, a pole, not a weighted bar, just learning how to do the movement pattern. And then you could bring them with a kettlebell and just start with, again, starting up from a nice tall stance, soften the knees, and then hip hinge back, sliding the kettlebell down the legs, and then coming all the way back up again. Most postnatal women prefer the Romanian stiff leg deadlift, where I'm slightly bent. I'm not fully bending the knees because they want to feel that stretch on the hamstrings. They want to feel the tension on the hamstrings. So usually you would only go as low as you feel, okay, now I start to feel my hamstrings, and then I can pull up. Only go as low as they can maintain a neutral spine, obviously. So just try it now while you're standing. Slide your hands down the leg. Pretend there's a wall here and you're trying to go backward, backward, backward. Keep your knees exactly the same way. And then keep widening your sitting bones. As soon as you feel tension here, you're going to slide the bar up the legs. Of course, you can use a weighted bar as well if they're used to that. But you just want to make sure they're doing proper connection breathing to avoid coning in this position when they're coming forward. So remember, coning is when the abdominals are just being hanged out, the rectus abdominis is split, the connective tissue is already thin, the linea alba is already very thin here, so we don't want things to just be hanging. We do want to be connecting, especially when we're in these kind of positions against gravity in the prenatal stages and also in the postnatal stages also. You can progress this by going into a split stance, so the leg comes back a little bit, and keeping my right knee really stiff and slightly bent. I'm just working on my right glute and hamstring. And as you can see, the arm, wait, I'll do the same position. The other arm comes out to the side. And this will help with balance quite a bit because you've got the support from the other leg, but at the same time, it's still working on your balance. And at the same time, it's very comfortable for someone with SPD because you're not splitting the legs too far apart. They're nice and close together, and we're still getting that single leg hip hinge, that single leg glute and hamstring focus on this side. Other ways you can hip hinge for both pre and postnatal, obviously, is glute hip thrusts. And a lot of women like to wear the band around their thighs just to get glute med abduction happening, as well as the glute max working on the hip extension. You want to bring the edge of the bench or the box, like the plyo box like this, at the edge of the shoulder blades at the bottom. If they're doing body weight, it's quite comfortable, nice to have the arms here. Drive the feet down, send the knees forward, and lift up as you squeeze, keeping the neck in line with the spine at all times. And some people prefer the eye line to be a little bit forward, especially if they have tension in the neck. So to progress this, you can either place a weight here if they're in the early stages of the pregnancy, like a kettlebell. It's nice if the trainer puts that and takes it out, so they're not having to struggle to do that. And obviously afterwards the bump is kind of in the way, but there's other ways you can progress this, either by adding repetitions or by lifting the toes so you're driving through your heels, or by doing single leg, or even wearing ankle weights on the leg that's lifted, and that will help them really focus on their pelvic stability also. So since they're already going to be wearing the band, you can then do a little post-exhaust sort of duck walk set, or glute band abduction walking right after that set. That could be a nice little super set there. So now we start with squats, and squats are extremely beneficial for both the pre and postnatal stages. We talked about that already in terms of it helping allow the pelvis to widen and open, especially if people are able to go all the way down, and especially if you're implementing proper breath technique on the way up so that you don't increase intra-abdominal pressure, as we talked about. Now, obviously, depending on the clients and what they're used to and their fitness level and what they've already been doing, they can continue doing their types of squats. But if you had a beginner, you would probably do your parallel basic squats, body weight air squats first. You could do them wider and allow them to go all the way down if they have the knee integrity and ankle and hip mobility to be able to do that. You could get them, of course, doing it sitting on and off a box as well if they really don't get the pattern, and that can help quite a bit. But it can also allow people to progress into something like a pistol squat. From here they can have their toe lightly touching, and then as they exhale they come up, of course connecting with their deep core muscles as they're lifting, and then eventually they may be able to progress to the leg lifted if they're not suffering from any SPD in the pubic area. Now, of course, we did say that when it comes to single leg, it's a good idea to keep doing it, but know that the client's balance is going to be a little bit off as the pregnancy progresses, typically. But certainly, it's still a good idea to train and strengthen the connective tissue and ligaments and keep the proprioception alive coming from the feet. Another version of squats that's very comfortable to do in terms of body weight squats is the ball squats. So you have, of course, the ball against your lower back. Your legs are a little bit forward, and then you just come down, straight down and straight up. So it's very comfortable because you're coming down to a 90 degrees, and you can really actually think of your breath here and your connections. If you've got the bump, you've just got to think of hugging the baby in closer to you as you're coming up, and then widening those sit bones on the descent and moving nice and slow. And you can even add a little bit of intensity here by adding some pulses, and maybe even taking it into different positions, like a first position on the tiptoes, just coming down and up. So they're really thinking about their sit bones, and they're able to synchronize the stretch of the legs with the pelvic floor lift, which we talked about already. TRX is also very comfortable. We don't have a TRX in this gym, but I'm just going to show you with the rope the idea. Of course, you're holding your TRX ropes or anything that feels sturdy, and you're going to inhale to come down and then exhale to come up. Inhale to come down and exhale to come up. And of course, with the TRX, you feel safe enough because of the handles to go back and down, nice and deep, all the way down. Goblet squats, of course, are very comfortable for prenatal. They actually work the core quite a bit, and it should feel normal to feel the core, but it shouldn't feel like everything is just in the core. You know, that's when it's too much intra-abdominal pressure. It should feel like the core is whispering, saying hello, not screaming. So as you do your goblet squat, typical, same way that they've learned to do it already, where they're resting the ball of the kettlebell or the head of the dumbbell against their chest. They take their position, shoulders are down. Inhale, we go only as low as is comfortable for them, and then exhale, you think of lifting your pelvic floor, drawing those zippers up all the way to that magnet at the center of the rib cage. So you're coming, inhale to come down. It could just be to here, where their elbows meet the thighs, and then you come all the way up. Sumo squats, of course, are very comfortable as well. So sumo squats with the legs wide, as we already talked about in the pelvic floor section, can really help synchronize the breath and that pelvic floor lift at the same time. It will give people the right awareness to really prepare for the delivery and the birth, and for the postnatal client, of course. Of course, you can do split squats as well. So probably quite a narrow stance, especially if they do have discomfort in the pelvis in the prenatal stages. If they don't have any of that going on, it's perfectly fine to do a normal split squat that they're used to. So it doesn't have to be forced. Don't force them to do it in a narrow stance if they actually feel fine doing a regular split squat. You could hold the kettlebell in one hand or both hands, both dumbbells on one side. Of course, if they're fitter and they've got good balance, then you could do your Bulgarian split squats as well, with a slight lean forward to really maximize that glute connection on the right side that I'm doing now. And again, this could be weighted with the dumbbells. And of course, I would avoid these things if there is strong SPD or significant symptoms of SPD happening in the pelvis. They wouldn't feel comfortable doing it anyway. So keep in communication with your client to find out what feels good for them. And always remember the RPE should be around 6 or 7 out of 10. You don't want to make them lift. It's not the time to be lifting super heavy. We don't want to take blood flow away from the fetus. We want everything to feel somewhat challenging, but still at comfortable levels where they're still able to exercise regularly without feeling any too much discomfort afterwards.